We'll wait for some people get on here a little bit here. Okay. I am Dr. Malea Jensen. Welcome to Dr. J's Prescription for Health. I am a family practice physician. Good morning, Eddie. Good morning, Carla. Yeah, I'm a family practice physician. I am located in Des Moines, Iowa. I have been practicing for a little over 27 years. So it's been a good ride, and I enjoy what I do. I especially like what I'm doing now. So that is who Dr. J is. Good morning, Eric. Thanks for being here. This is your opportunity to ask questions if you have them, medical questions, but please keep in mind this is not medical advice. This is for information purposes only. Good morning, Lucy. Thank you for being here. I am live on Instagram and YouTube. So for those of you who are on YouTube right now, I have some blue wrenches. They are my helpers. They're my center stage helpers, and they, please be kind. That's all I'm asking. So, all right, you guys. Good. Okay, so who is Dr. J? I just mentioned to you that I am in Iowa. I'm a family practice physician. I'm board certified, and I've been practicing for 27 years. I want to let everybody know, especially on YouTube, that I do have a new store, a new center stage store for apparel and some other accessories. So please check that out, and that helps support my channel. I did not mark them up at the recommended markups, so this is just between you guys and myself. On Instagram, if you go to my homepage, you will see a link tree, and in the link tree, you will see a link to the store, the apparel store. I don't know what I want to call it yet. For the graphics on the items that are in there right now, I want to thank Jim. If you're listening, Jim, I appreciate you. And I used the graphics that you had sent me. And so this opens up another option for you guys if you want to be a part of the center stage community and help with graphics. If you have a great graphic and you want it on a shirt or sweatshirt or hoodie or whatnot, a hat, send them to me. If they are, appropriate, and we agree together that those are cool, and you want to donate your graphic to Center Stage Primary Care, to Dr. J, to Dr. J's Prescription for Health, to the Bamboozled Buster, all of that, then great. Send them to me, and I'll look them over. I appreciate everything in advance. So, good morning, Carla. Good morning, Bob and Derek. Thanks for being here. What else do I have? I wrote some things down. Just to set the stage, if you would like to or are interested in consultations, please email me at IronLadyDoc@AOL.com. What do? I go over your labs. I go over your medications, your medical diagnoses. I go over your exercise, your diet regimen. Does it take the place of your primary care physician? No, this is not medical advice. It's for information purposes only. So let's see. Good morning, Turbo. Good. Okay. Let's see if we got some questions coming in. Okay. Nothing yet. So this is the opportunity to ask questions. Oh, you know what? Put you in timeout. There we go. Okay. All right. So this is your opportunity. Ask away. I am live on Instagram and YouTube. You can also find me on Rumble at IronLadyDoc. I'm on Twitter or X at IronLadyDoc. I'm on Facebook at Center Stage Primary Care. This is for medical questions only, so let's see. There we go. All right. Do daily vitamins actually work? Work for what, Rob? What are you taking What are you taking vitamins for? My thought process on vitamins or any supplement, when you say, do I need to take any supplements? I'd first ask, what is your diet? Because to me, if you're taking supplements, you're telling me that you need to supplement your diet. It doesn't offer the things that you need. So I would start first with your diet and make sure that it is providing a dense nutritional value. Taking daily vitamins, that just tells me that your diet's not very good. Okay. Lou, I do not know the answer to that question. Chris asks, what is my position on low-carb diet? I follow a low-carb diet, if that answers your question. Good morning, Retail My Ride. I appreciate you being here. B1 asks, how much steroids, medical, not illegal, it really doesn't matter, does it take to start causing hair loss? It's going to be different for everybody. If you are, you could get a DHT level, that will tell you. So have your doctor get a DHT level and see where that stands. But everybody is different when they are taking hormone replacement therapy or TRT. Yeah, 1, 2, 3, I would agree. Getting your vitamins and minerals from your food is very important. Yeah, Rob, I understand the 50 plus vitamins, but it doesn't matter how old you are. If you're eating a crapola diet, you're going to have crapola health. And so taking a multivitamin or any kind of vitamin is not going to be of any benefit to you long term. 1, 2, 3, that's cute. Keystone Light, that's a very old beverage. Do they still sell that? B1, I agree. Getting sunlight, but remember, you can, even in the wintertime or in the cold, I'm in Iowa, I just expose my eyes and my face to the sun for 15 minutes every day, and that provides enough vitamin D. In fact, the storage vitamin D can store upwards to 6 months. So if you were outside in the sun during the summer months, you likely have enough stored vitamin D. Now, whether or not you can shift that stored vitamin D to active vitamin D, that's a good question. Yeah, I agree. Lucy's, my moderator, my blue wrencher is saying, please add a QQQ before every question. If you want your question answered super duper fast or ahead of everybody else, please use the super chat, the super sticker, the super everything. That helps me. It helps get your question higher on the totem pole to get answered. So I do appreciate it, the super chats and super stickers. So thank you in advance. That it means a lot to me about your generosity. Matt says, should you take creatine even if you don't work out? Good question. I don't know that there is an exact answer to that. Will creatine hurt you? Again, here's what I say about creatine. I believe that if you are eating a moderate amount of animal meats, you will get all the creatine you need, whether or not you work out or don't work out. Now, I am well aware that people are, there are studies out there, or people are doing, even if it's N of 1 studies or N of 10, there are doctors out there who are doing studies on creatine at higher doses. I believe if you listen to Dr. Gabriella Lynch, is that her last name? I think that's her last name. I can't remember. She talks a lot about creatine. They have been doing some studies on very high dose, upwards to 15 grams per day. So that would be about 3 teaspoons per day. Whether or not people are working out or not, it could help with muscle preservation. It could help with brain health. These are ongoing questions. I just don't know if I know the right answer. Unless somebody is poisoning in the jar, I'm not aware right now of any negatives of taking creatine, but do you actually need it? And is that really what it is? Oop, I just missed some questions. Sorry. Somebody flipped ahead and I missed some questions. Anu says, can I consume vitamin D instead? Well, you got to be careful with what I would check a vitamin D level, both active and stored, and get a ratio. You want an active vitamin D of about 45, a stored vitamin D around 22, 23, maybe upwards to 25. That would be a good ratio of 2 to 1 of active vitamin D to stored vitamin D. Taking vitamin D when you don't need it can have bad repercussions. It can change your vitamin A levels, which can mess with your copper. And if you mess with your copper, you mess with your iron, and so on and so forth. So you're messing with normal physiologic and biologic process by taking anything, whether it be pharmaceuticals via prescription or over-the-counter medications. Steve says, yes, Keystone Light is still around. I mean, back in the day it was good, so why wouldn't it be good now? Okay. So I got the creatine, I got the vitamin D. There was another question. You guys are really kind of over there on Instagram just being all nice and listening. So most of the questions right now are coming from YouTube. So if you Instagrammers have any questions, please let me know. Hello, doctor. Do you go to the doctor when you get sick? I don't. I haven't been sick for years. Not for years. Yeah. But I would try to figure it out myself. Anun, that is very common, especially in the winter months, to have very dry skin. But I would also look at getting, a good set of labs and making sure that everything else is okay. South Pennsylvania, do you have concerns? If you have a concern or a question, let us know. But that is an inappropriate question and has nothing to do with our medical questions. So please rephrase, and the moderators are on board to help me out. Exactly, Lucy. Please ask health-related questions. Thank you. Connor says, my neck hurts after workouts sometimes. What do you think is the reason? I don't know. You probably need to get some x-rays. A lot of people, when they work out, and I've seen it, I actually used to do it a lot. And one of my workout partners, he hurt his neck all the time when he was working out with me. Again, I do push people to extremes, I believe. And so he was lifting heavy weights. But a lot of us will get very, very tense when we're lifting, especially on tricep day. And why do I say that? Is because skull crushers or even, heavy dumbbell pullovers for your back or even your upper chest. You can use dumbbell pullovers for chest and back. We tend to get very tense, and we'll do this, and we will tighten our neck. And actually, if we're breathing wrong and taking a breath at the same time, your body cannot stay tight at the exact same time. So if you have any type of, already your muscles in your neck have been injured, or you have some vertebral issues, disc issues, I would get an x-ray, if not an MRI. But watch when you're lifting and how tense you are. B1 says, I still think vitamins can be good for someone in the thought of taking care of themselves. If it goes into piss, that's okay. It might help a little. Well, B1, I would look into how the vitamins that you are suggesting actually block normal physiologic processes in your body, and stating that they can be good for people without giving them informed consent on what they could do bad for them is actually doing them a disservice. So I would refrain from stating that. Connor does take creatine. Okay, thanks. Michael, maybe to a sauna and use ice. Gabrielle Lyon, thank you, Lucy. I appreciate that. You don't need to know, is vaping really bad for you? I don't know. You're asking the question, so you must have an intuition that it's really bad for you. I think I would go with your intuition. Hello, Arnold. Christian, vitamin D, like the sun. Yes, vitamin D from the sun is a good source. VM asks, nitric oxide effect on arteries. It helps to vasodilate. Nitric oxide has been studied a lot in not only in supplementation form, but actually in pharmaceuticals. When Park Davis first came out with an ACE inhibitor called Acupril, that was the brand name. The generic name is called Quinapril. They actually did studies on how that particular ACE inhibitors caused an increase in nitric oxide release. Bistolic, that is the brand name. Nebivolol is the generic name. Also did similar studies indicating that nitric oxide is released from the endothelial cells with those medications. You could take nitric oxide on its own. I've heard people taking L-arginine. I've heard of people taking L-citrulline, the malate form. Nitric oxide is very important. I think we make our own, but we do stuff that harms our own natural production of nitric oxide. One, mouth bacteria produce nitric oxide. And we destroy our bacteria that produce nitric oxide by using antiseptic mouthwashes. The endothelium of our arteries also make nitric oxide. The endothelial cells will release nitric oxide or secrete it. When the endothelial cells are damaged, inflamed, they do not release nitric oxide, or if they do, sometimes they're being used up to take care of other reactive oxygen species. So they're taking care of a lot of oxidation that's going on, especially if you have chronic stress. So a person with chronic stress who has a high sympathetic tone and low parasympathetic tone, so low calming, high fight or flight, they will use up a lot of nitric oxide to reduce those reactive oxygen species. There's just so much of them. So you might have great production in your endothelium. You don't have any inflammation, but yet you have a lot of stress. Now, stress does, the fight or flight does cause inflammatory condition, but I'm just saying, we need nitric oxide to be used for other things and not being used up for all the reactive oxygen species that we're doing. Let's see where we're at here. Most people are vitamin D deficient. Well, I guess it would depend on what level of vitamin D you're checking. If you have high amounts of active vitamin D, then you have enough. What your doctor is treating is the stored vitamin D, and that is not giving you enough information. So South PA says, I have really high cholesterol and triglycerides. My nurse practitioner wants to put me on statins, which I said no to. What can I do naturally? How does somebody lower triglyceride levels? Does anybody know how to lower triglyceride levels? Nobody wants to answer. Okay. In order to lower triglyceride levels, you lower your carbohydrate content. You eat low carb diet or no carb diet, you get rid of your alcohol. Those are common things that increase our risk of having high triglycerides. The fact that you have high triglycerides over 70 is high. puts you in a metabolic health risk. So the things that you need to check for metabolic health, or the markers, would be your blood sugar. You want a blood sugar, fasting blood sugar around 70, 80. You want to check your blood pressure. A good blood pressure will be around 120/80. You want to check your waist size, your waist circumference. High waist circumference, over 40 in a man, over 35 in a female, those are high risk for metabolic health. You want to measure your triglycerides. What you're worried about right now is high triglycerides. So anything over 70, they will tell you anything really over 150 is normal. It is not. That is not optimal. You are at metabolic risk if they're over 70. HDL, you want a high HDL. HDL over 50 would be in your best interest. In fact, I look for values in the 70s. I want a 1-to-1 ratio of triglycerides to HDL or less. If Extra wants to ask a question, ask away. Okay. Songs asks, where are you from? I'm from Iowa. Retail My Right says, trigs are harder to lower for some of us. We just have to look a little deeper, right? Retail, we got to look a little bit deeper. It's looking at other lab values, isn't it? Let's see. A lot of you are just giving statements. We're moving on to the questions. If you want your question advanced higher on the list, then do a super chat. I appreciate it. Thank you. Scrum says, I have always been told to take vitamin D living in Washington State and not getting a lot of sun. Especially in the winter months, I feel better taking it. How do you stay from getting sick? Again, Scrums, I would definitely check your vitamin D active level and your vitamin D stored level and see where you're at. How do you stay away from, I would also check your vitamin A level, and I would check a RBC copper level, an RBC magnesium level, RBC selenium, RBC zinc, and I would get iron studies. Iron, ferritin, transferrin, total iron binding capacity, and iron saturation. I would get that. Yes, you probably feel better, but are you destroying yourself in the process? How long are you going to keep feeling better? Joel says how do I stay from getting sick? I follow a very low carb diet. I exercise, I sleep, I get outside, even in the wintertime. I expose the skin on my face to the sun. I think positive. I pray. Yeah, I take care of myself. Low stress. Let's see. Lara says, for unexplained low back pain, no known injury, what would they look for by doing an MRI? They're looking at your disc health. They're looking at the nerves coming out of those disc spaces and whether or not they're being pinched. They're looking for other things. Sometimes we can get masses on those areas of our back. But I would also incorporate just a simple x-ray for your low back as well. I'm guessing you already did that because I don't think any doctor would probably jump right to an MRI. Let's see. Joel says that he did all of his labs and they came back negative. Negative for what? Hi, Chris. Here's a question. Mindset installed. What's good to strip heavy metals? Prevention of dementia. I've heard the connection, avoid aluminum, deodorant, avoid heavy metals in general, right? But it's hard to stop breathing the air. They're in our air, they're in our food. Heavy metals are all around us. Simply doing a detox really no service to you. It would be something that would need to be done on a regular basis because these metals are coming into our body all the time. We eat processed food. It's going to be contaminated with heavy metals. Plant food, plants in general are high in heavy metals because they're growing in the ground. They're full of whatever's in your soil. So I tend to stay away from those. Do heavy metals build up? Or iron builds up in your brain. So aluminum builds up in your brain. Is there something you could look into mindset? Do some deep research in or on glucoferrin, glucoferrin. I've heard people taking EDTA. Again, I'm not sure that there's actually a new medication that's out, and I cannot think of the name, that helps to bind heavy metals. Let's see. Okay, answered that question. Let's see. Vitamins or treatments for occipital neuralgia. I would see your doctor, but no, occipital neuralgia, pain of the nerves in the back of your head. I would look into what's causing that before I would start taking any vitamins. Dino, for dry skin on your face, you're putting products on it that could be worsening it. There's a lot of things. If you guys would like to consider a consultation to get some information and take it back to your doctor, that would be awesome. Just email me at IronLadyDoc@AOL.com. Thank you. Okay. All right. Joey says, dementia really scares me, especially being alone a lot. It does. So it's just one more reason to, change your lifestyle, lower your carbs in your diet. Carbs increase blood sugar. Blood sugar increases insulin. Insulin has been known to cause brain cells to even be insulin resistant. So they need a good source of fuel, whether that be ketones or blood glucose. But dementia, I believe, is a lot caused by our diet, lack of exercise, high stress, not enough sleep. There's a lot of things that increase your risk. Joy, I understand that that's a scary proposition for you, but it's worth it making some changes. You're very welcome, Lara. Thanks for asking your question. Rain wants to know how to flatten the belly. 54-year-old female, averages 7,000 steps a day. Again, if you want to schedule a consultation, email me at IronLadyDoc@AOL.com and we can go over some things. Bill Clancy asks, is chaga a good thing to take for arthritis? What is causing your arthritis first? Have we tried to change that? How about we subtract things before we add things? I'm going to skip to the end. If you guys have questions, you want your questions answered, please super chat or put a Q in front of it. Michael says, I think something is wrong with me when people say, look at your veins. My nurse used to do that. She goes, oh, you got good veins. You're going to be an easy blood draw. I remember her saying that. Analystra, I'm not sure. Any thoughts on the upcoming stem cell trials for type 1 diabetes? I am not familiar. Vertex Pharma in Boston is one. I can look into it. Thank you. Good morning, RM. Thanks for being here. Zucky, when Zucky has a high diastolic pressure. So when you're looking at your blood pressure, like 120/80, the top number is your systolic pressure and the bottom number is your diastolic pressure. For the most part, you can explain it in simple terms as your systolic pressure, the contraction and pushing out of blood, and the diastolic number is the filling pressure. How much pressure is your heart under when it is filling? So if the heart is under pressure when it's filling, that means it's going to take longer. And so 89 to 108 is higher. You got to ask yourself, what is causing your heart failure? You know, I would get an echo. I would look into some things, maybe see a cardiologist. Are you an exerciser? Do you over-exercise? Are you extreme cardio person, such as long distance running or heavy 1 hour rides on your bicycle? These competition athletes, they're at very high risk for CHF, even left ventricular hypertrophy, AFib, diastolic dysfunction, all of those things. So Zucky, to answer your question simply, I don't know what's causing your blood pressure, diastolic blood pressure to be 89 to 108, but I would definitely have that looked into. Asking your doctor for a MRI would be in your best interest. Nancy was trying to answer a question from my Instagrammer. She just wanted to know what an MRI show, but Nancy is actually adding to what could explain low back pain. And I'll give you some things that this Nancy, which I agree with, tight quadratus lumborum, so your QL, tight glute muscles, both gluteus maximus and gluteus medius, your hip rotators, and your piriformis, which is definitely a muscle we don't concentrate on a lot. When it's inflamed, it leads a lot to sciatica, because the sciatic nerve will traverse the piriformis muscle that's in your butt. Tight hamstrings can cause problems with low back. Remember the posterior chain, which is all what Nancy is bringing up, is the posterior chain and the dynamics with the posterior chain. The tight QL, the tight glute muscles, both the maximus and the medius. Tight hamstrings can all cause, it's tight psoas. Because the psoas actually is one of the hip flexors, so it's going to be found on your front side, so that's not part of your posterior chain specifically, but the iliopsoas, the rectus femoris, and the psoas muscle itself, the iliacus, the psoas, and the rectus femoris are muscles to be checked, especially from a physical therapy standpoint. Make sure I didn't miss any questions here. Lucy says, is this a new medication or supplement? It's a medication, Lucy. Thanks for asking. That binds heavy metals. It was sent to I get emails on updates regarding new medications that come out. So, and I just can't remember the name. Should we skip to the end to answer questions? Please skip to the end because I'm tired of listening. Okay, thank you for the super sticker. I appreciate it. Here we go. Your thoughts on Ozempic. That's a GLP. So Ozempic is semaglutide. It is a GLP, and it is used in diabetes. The main source of, here we go. We don't need to be listening to that. So your thoughts on Ozempic. Ozempic was originally used for diabetes. And then, of course, there's always spin-offs. So the spin-off of Ozempic is Wegovy, and that was approved for weight loss. I would ask yourself, hi, what are you using Ozempic for? It is a GLP. We do have GLP made in our body in several areas. And so why are we adding a GLP? I could give you a whole bunch of pros. I can give you a whole bunch of cons. So maybe ask a question and we can go from there. I agree, Drake. Sitting for long periods of time can do a number on our low back. I'm guessing that's what you're speaking to. Oh, Michael, maybe let them know where they can chop some wood with you. I understand. William needs help with organic chemistry. I'm pretty sure everybody needs help with organic chemistry. Terry uses kettlebells when working out his muscles. That's awesome. I'm guessing it's a him. Hi, Anthony. Thanks for joining. Who's Luke? I'd like to know who Luke is. Zucky says, yes, doctor, I do run 40 to 60 minutes daily. Is it too much running? Well, moderate exercise is beneficial, but extreme exercise, now, what are the definitions of moderate versus extreme? I can give you just an anecdotal from either clients of mine, but it is possible, Zucky, that you are increasing your risk of congestive heart failure simply by what I would consider extreme exercise. So extreme cardio on a daily basis, 60 minutes a day. You know, my own father, just to tell you a little bit about my story, my dad was an athlete. He ran every day. When I was in college, I did get him to start lifting weights. He loved it. He did both cardio. He continued to run 5, 6, 7 miles a day and lift weights. He was very healthy. He went to the doctor and they told him his cholesterol was high. He stopped eating red meat. He boiled his chicken. He ate tuna. He ate sugar-free ice cream, bran flakes for the fiber, of course. He ate vegetables. He ate rice and beans, and that was about it. His heart was functioning optimally until it didn't. My dad went into VTAC very young after an exercise routine, his running outside. He was brought back to life, praise the Lord. He was taken to the local hospital and then transferred to Des Moines, Iowa, praise the Lord. They did an echocardiogram. They did an angiogram. He had 5-vessel blockage. Again, he was eating no fat in his diet, 0. He boiled everything. Any meat that he ate, he didn't eat egg yolks. He ate egg whites. I forgot to say that. He ate a ton of protein powder. He drank smoothies every single day after his workout. His smoothie would have been bran flakes, sugar-free ice cream, flaxseed, and I believe he put olive oil in there as well as with the protein powder. My dad subsequently developed AFib, congestive heart failure. This is as he was aging. He did have a cabbage of all 5 vessels that were blocked 100%. He experienced angiogenesis, which is basically branching off of the arteries to supply blood flow to the heart. Therefore, he did not have a heart attack. He actually had excellent blood flow to his heart, yet they bypassed him anyway. That is typical of cardiologists. What confused me at the time is the CHF and the AFib. But now that I have looked back and I've done research, the extreme cardio that he did, which was 7 miles a day, every day, running for an hour or more for, I bet, 40 plus years. I believe the high sugar diet, even though he was sugar-free ice cream on a daily basis, he was eating a lot of maltodextrin. He was very thin, as you can expect. He did not have a lot of ketones. I believe now, looking back, he was never in ketosis. He never fasted. He ate multiple times a day. I forgot he ate a lot of oatmeal, cups full of dry oatmeal that was cooked. So it ended up being a very large bowl of oatmeal every single morning. AFib is secondary to chronic atrial pressure. The atrium are on the top of your heart, the ventricles are on the bottom. The atriums, due to this pressure, they start to dilate, they get inflamed, they get fibrotic. This is what extreme exercise does to us. It leads to endothelial dysfunction. That's why I believe my dad had 5-vessel cardiovascular disease. So all 5 of his main arteries in his heart were blocked completely, 100%. So extreme exercise leads not only to electrical problems, it leads to plumbing problems, which is the coronary artery disease. Because of the pressure, it leads to arterial stiffness. I believe that's where the plaque all started, from the endothelial dysfunction and injury. Praise the Lord, my dad never had a stroke, but that increases the risk of vascular injury, increases the risk of blood clots. Athletes tend to have high risk of coronary artery disease because they get more plaque formation. Now, that plaque formation is likely more calcified and more stable, but you and I both know that when you get a calcium score and it's above 0, you're at risk of coronary artery disease. CHF, congestive heart failure, which could be an indication from your high diastolic blood pressure, the lower number on your blood pressure. I would definitely ask your doctor for an echo. That could be congested. That could be heart failure. It could be chronic. It could be acute. We don't know. That is likely due to increased cardiac remodeling. So the heart is trying to remodel. It's fibrotic. You're getting, especially of the right ventricle. And then that creates a substrate for more arrhythmias, which is, your AFib. Or like in my dad's case, he got VTAC. Now, did he get AFib? I believe he did at the end. But in all of that, he was placed on a statin, and he was also diagnosed with a form of Parkinson's disease called progressive, and I mean fast. Less than 7 years of having this disorder, my dad passed away, not of his heart, but of progressive supranuclear palsy. I believe from all of the sugar, from the vasculature, that his diet, which you would think to yourself, well, it's low fat, it's high carbs, exactly what the guidelines recommended. Especially he was what I would think is basically a little Mediterranean-ish. He did everything the doctor told him to do. And he attained every disorder that I'm now studying because of his diet, because of his chronic exercise cardio routine. And it's hard to talk to people because who do extreme cardio, marathons, or like you said, running for 60 minutes a day. It's hard because you get a high, you get a dopamine high. Luke, if you want to know more about me, read the description, okay? Michael's in Ohio. So anybody who wants to chop wood with, who lives in Ohio near Michael, ask him. He's got some wood to chop. Drake says, are you actually made of iron? No, you have iron in you, and it's absolutely essential that we have iron. Are there any other questions in regards to exercise, how it increases our risk of AFib, coronary artery disease, congestive heart failure? You need to speak with your doctor. This is a tough subject because most doctors will congratulate you on your exercise routine, but I'm telling you from experience that exercise in especially cardiovascular activities is worsening your heart function. That's all I can say. All right. Julie says that she's having trouble with her reality, and I suggest that she see her psychiatrist or a psychiatrist who can walk her through. Oh, thank you, RM, for answering that question. I appreciate that. Anthony runs 8 miles a day. Okay. Maybe make some changes. You also have to look into chronic cardio and what your diet looks like, because you're probably increasing your insulin level. mTOR is activated during eating and during exercise. So chronic mTOR, so chronic growth of cells all the time. mTOR never has a chance to come back down. Insulin never has a chance to come back down. I would get an insulin level. I would check your cardiac markers again. Check your blood sugar, your blood pressure, your waist circumference, your triglycerides, your HDL. And I would check metabolic markers like your insulin, your fasting blood sugar. I would get a HOMA-IR score, HOMA-IR. How do you figure that out? Well, if you know your fasting blood sugar and you know your fasting insulin, you take your fasting blood sugar times your fasting insulin. So blood sugar times insulin, and then you divide that by 405. If you're in America, you divide that by 405. If you're in another country, that you would get your fasting blood sugar in your units, fasting blood sugar times insulin, and divide it by 20, I believe it's 22.5. Hopefully that helps, but is that too much running on your knees? Well, it depends on what they want to do. But yeah, you're causing compression. Your whole body, I mean, the force that's coming down on your knees and your lower extremities from running on the pavement, 7, 8, 9, 10 miles. My dad's knees were, they were a mess. He didn't even have knees, really. He was this skinny guy that had round knees. They were like round, balls for his knees. You couldn't see where his kneecap was. That was all osteoarthritis. That was degenerative arthritis. He had no meniscus left. So it's up to you guys. I mean, I'm just telling you but we all have to decide. I did a lot of things in my past. I lifted weights, heavy weights that no little girl should be. I'm pretty small. No little girl should be lifting that much weight. I destroyed my joints. However, I also, I was a bodybuilder. So in between shows, and training for and competing and getting ready for shows, I ate a standard American diet. Okay? And that was to my destruction as well. You're eating a lot of carbs, a lot of sugar, which causes a lot of glycation, a lot of aging of the joints, a lot of aging of your whole body. I was eating processed foods in that time, even cereal, and that is full of non-heme iron. Anything that comes in a plant or in plants make up the carbs that come in processed foods. Those are all from a supply of non-heme iron. It's so I did a lot of things in my past. I can't take back. I don't have it. You coulda, shoulda, wouldas. I can't take back. But I'm not going to lift that heavy now, nor am I going to ever do cardio like my dad did. Okay? It's just not. It's not in my best interest. Melanie says, I'm not sure if you got this, but how are fasting blood sugar and triglyceride levels different? Triglyceride is a glycerol backbone with 3 fatty acids attached. Fasting blood sugar is glucose. So glucose and a glycerol backbone with fatty acids are 2 different things. When your triglycerides are elevated, you'll likely have fasting blood sugars that are elevated, but mainly probably insulin. So a high triglyceride level tells me right there that you have metabolic dysfunction. I would get an insulin. I would check an HDL. Remember, if your triglycerides are high, HDL is notoriously low. it's almost 100% chance that your HDL is going to be low in the presence of high triglycerides. Triglycerides are elevated with consumption of carbohydrates, and which is sugar. These lead to increased amounts of small dense LDLs which are atherogenic. The small dense LDLs. That's why I think everybody needs to be getting, if they can afford it, I would get an NMR. It's a nuclear magnetic resonance, an advanced lipid test, advanced lipid test, and know what your particle number is, the particle size, know it all, because that will give you more information in regards to your metabolic health and your risk of coronary artery disease. So yes, they will be two different things on your labs. One will be on the lipid panel, triglycerides, and the other, fasting blood sugar, will be on your complete metabolic profile. So the metabolic profile. Okay? Good question. Thank you for asking that. And hopefully I answered your question. Okay. Simply Delicious says they still can't figure out if eggs are good for you or bad for you. Well, here's what I can say. Eggs are 100% bioavailable, and they have a 1-to-1 ratio of protein to fat. They are nutritionally dense, the most nutritionally dense food out there. So you have to ask yourself, who can't figure out if eggs are good for you or bad for you? We would never have chickies rehatch, or, we wouldn't have birds in the first place if eggs were not good for us. Okay. Thank you, Lucy. It's actually, consultations are $110 per hour. Thank you. Anthony does have AFib and was cardioverted 4 times. Yep. Lots going on. Anthony, consider a consultation. We can walk through this. Okay. If you have a question, put a question mark in front, and I will answer your questions. And we're bypassing all of the Simply says processed sugar and high fructose corn syrup are bad. How about just sugar in general? High fructose corn syrup, and let's add in fructose, are bad for you. They all glycate. So glycation is sugar binding to proteins. It's the amount of glycation that's going on that is damaging. Dr. J, there is a super chat question. How come I cannot see it? Who has a super chat question? Should I skip to the end to find the super chat? Usually they pop up, but I do not see a super chat. Oh, I do see a super chat. Here we go. How much protein I should take for muscle growth? I would take 1 gram per pound of body weight per pound of ideal body weight. If you're exercising and you want to grow your muscles, I would get 1 gram per pound of ideal body weight. Thank you for the super chat. That was very kind. And I apologize that I missed it. And I want to thank Lucy for reminding me. I thought they actually popped up on my screen, but they do not. So thank you, Lucy. That's why I have moderators. I appreciate that. Zucky says, okay, less cardio then. I would incorporate HIIT. Zuki, use HIIT, high intensity interval training, for your cardio, and lift weights. So maybe 2-3 days a week do your HIIT, and the remainder of the days do resistance training. RM, am I saying that running marathons is bad altogether or just excessive? I'm going to go with running or jogging or doing anything. That is extreme. Marathons are extreme. 24-hour runs, they're extreme. Excess cardio every single day, that's extreme. Cardio is going to contribute to increased risk of CHF, AFib, left ventricular hypertrophy, increase reactive oxygen species. You're going to deplete your nitric oxide. There's a lot of things going on. So no, I cannot recommend long distance or long cardio sessions at all. Sorry. I have experienced this way too many times, and I've seen it's almost straight across the board in a linear fashion that high amounts of cardiovascular activities increases our risk of cardiovascular disease, not improving it. Going for a 1 hour walk is much different than running. How do you make your heart stronger? You eat a diet that is what I consider allowing you to get into ketosis. The heart is much better. It heals much better with ketones. Ketones are anti-inflammatory. The heart heals with ketones. A failing heart is a heart that is starving for energy. If you say, it's carbs, it needs sugar, obviously you didn't get to where you're at with heart failure by eating an all meat or ketogenic diet. You got there because you were eating high carbs and doing long distance, whatever, cardiovascular. So switching to a ketone or a ketotic diet or a ketogenic diet seems like it would be in your best interest. The ketones generate more ATP per oxygen molecule. They increase your cardiac output, and they also increase your stroke volume. They also decrease vascular resistance. They're anti-inflammatory. That's what ketones are. Especially beta-hydroxybutyrate. It's one of the main ketone bodies, beta-hydroxybutyrate. Beta-hydroxybutyrate also increases angiogenesis, something that my dad's exercise, fortunately, praise the Lord, increased. However, a ketogenic diet would have been much better for him. He might not have gotten progressive supranuclear palsy. He might not have gotten CHF, coronary artery disease, left ventricular hypertrophy. Mind you, he was on a statin, so caused a lot of muscle aches and pains, caused a lot of depletion of CoQ10, likely decreased his vitamin D level. We never checked it. And he had no testosterone because he didn't need any cholesterol. And he was on a statin-lowering drug, putting him down way below 70, so he couldn't even make his own testosterone. No hormones. Okay, is there more? Lucy, if you're over there, are there more super chat questions? Pasquale, Iron Lady, do you think your dad prolonged his life with fitness or shortened it? I think it was the combination of his extreme fitness as well as his high carb. I mean, his diet was, I'm not joking, was probably 70% carbohydrates and no fat and maybe 30% protein. That was he listened to the doctors, and I believe that was the death of him. He had, if you go into it, he had colon polyps as well. They were removed, so that's awesome. But again, I truly believe that he would have had a longer life. I can't prove that. No, I don't have coulda, shoulda, wouldas, but when as I'm in my journey and I'm increasing my knowledge and education, I'm looking back. That's what we have to do, is how we educate ourselves. I have to empty out all of the experiences I filled up in my cup. LDL is bad for you. Saturated fat causes coronary artery disease. Your blood sugar is normal, so you don't have diabetes. Without looking at the insulin, without getting a HOMA IR, without doing all these things. We have to increase our knowledge. You can't just sit status quo. You're missing things. So to answer your question, yeah, I think my dad had shortened his life. He didn't know. I didn't know. I was in medical school. I did not know. Because I was being brainwashed with all of the stuff they wanted me to learn. In fact, I did it for, 23 years of practice. It wasn't up until the last 4 or 5 years of my practice that I have escaped the matrix, escaped the cognitive dissonance, escaped the brainwashing. And I am thankful to patients that brought it to my attention, that gave me things to read, I had one patient bring me 7 books. You might have heard this story. I had a patient bring me 7 books and he said, please read these. I think that you will change your tune when you get done reading them. I've had other patients watch Dr. Ken Berry. There were some other ones that were new when I was first getting started. I can't remember who they are, all of them. It's people I'm still watching to this day, okay? Dr. Malcolm Kendrick. I would have never believed anything Malcolm Kendrick said until I allowed myself to empty out the experiences to allow new experiences to fill my cup. I read The Clot Thickens, and I was blown away. And I have some regrets, but I can't have regrets in that aspect because I didn't know. But I didn't know because I was being fed the information they want us to know. Even in our continuing medical education, you have to have continuing medical education in order to keep your licensure and do boards. The continuing medical education, everything is pharma sponsored, everything. They will call it non-biased, but you know it is because you know if you know, your eyes are opened, you know when you're being influenced, and it's difficult. So I just do the continuing medical education because you got to do it, okay? But I'm going outside the box and I'm continuing to learn. And, if you listen to chiropractors and they're talking about, water in the the third, whatever it's called, I can't even remember. If you listen to Stephen Hussey, I've learned a lot from him. I read his book. Now, there's some things I don't agree with him, but how am I going to know? So, gosh. Let's see. Terry says, is walking 5 miles a day good? Well, as long as you have some resistance training going on. You need to do resistance training, okay? Having muscle is the organ of longevity. Nobody's going to ask you if you can walk 5 miles, at the end of the day. But they're going to ask if you can get out of the chair, get up out of your toilet seat. And if you can't, you go to a facility. Do you want to go to a facility? If that's what you want to do and you want to play bingo and do all those things, then go. Lejan says, I have AFib but don't want to take anticoagulants. Then good luck if you, don't want to have a blood clot form because of your atrial fibrillation. Atrial fibrillation is basically the atrium fibrillating instead of beating rhythmically. So it's beating out of sorts. It's bum, 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 bum. It's very, very irregular. We call it irregularly irregular. There's not even a pattern to AFib. When our atrium is doing that fibrillation, blood clots is not, the blood is pooling in that atrium, can't get out. So it can clot. And then when it does pump at the right time, boom, you just throw a blood clot to your brain, your heart, wherever, okay? Your lungs. So you're at very high risk. I do have patients who choose not to do anticoagulants. They choose something else. Okay. Buga says, why are runners often look gaunt? Because they lose their fat pads. Their fat pads all over their body, especially in their face, which gives you that gaunt look. So even bodybuilders, you start looking at bodybuilders in their older age, people who dieted extreme, which bodybuilding is, you lose the fat pads. Once you lose the fat pads in your face, they don't come back. Unless, of course, you go to an awesome plastic surgeon who can do fat pad. They'll take it from somewhere else and put it in your face. Okay, transplants, that's my word for it. So they will do a fat pad transplant. So the runners, because of their extreme nature of their exercise, lose the fat pads in their face. That is what it is. Dr. J has no fat pads in her face. So it is what it is. They will, sometimes it will look, it could cause you to look older. Other cases, people don't notice as much. But yeah. So yeah, it is a extreme way to cause a lot of oxidation. When you're doing extreme cardio, you're increasing oxidation, causing reactive oxygen species, and you're using up all of your artillery, all of your antioxidants, your vitamin C, your vitamin D, your vitamin E. The answer is not to take more of those things. The answer is to take away what's causing the increased amounts of oxidation, okay? That's what's going on. For those of you who are asking on Instagram, we do have a live fundraiser for rescue, rehab, and rehome. My goal is $100. I do that once a month. That is where I got Tallow, my Tallow, rescue, rehab, and rehome. It's in Iowa. And he is a love of my life. Let's see. Okay. Daryl says, I'm feeling pains in my main arteries of my inner thighs. Those are likely veins that you're feeling pressure from. And your inner arms, I would see your doctor, get a venous duplex, get a venous or an arterial duplex. But I think that's important. See your doctor. Shireen says, is moderate alcohol twice a week acceptable? Well, it's acceptable if you want to put a poison in your body. It's a toxin. So you have to decide for yourself. You can, it's up to you whether it's acceptable or not acceptable. Zucky says, once my doctor suggested I walk for 2 hours to reduce stress. That's possible. You could decrease your sympathetic tone and increase your parasympathetic tone, but you can also do some breathing exercises and not have to walk for 2 hours. It's up to you though. Thanks, James. I appreciate your help. You guys are all eating eggs. Good for you. Tobias says, I was diagnosed with thyroid disorder. They found out that I had Parkinson's. I agree, James. Solid choice are eggs. Anthony, I don't know what your question is, so if you want it, consider a super chat, but I'm trying to read through these questions. It's very difficult. Carson says, you told me once that my zonulin was elevated. Well, I didn't tell you you had a high zonulin. I said, have your zonulin level checked. It's a blood test. So get your zonulin level checked. Zonulin is an inflammatory marker indicative of inflammatory bowel disease like celiac or, like I said, irritable bowel disorder. It's inflammation of your lining in your bowels. Do I think laughing is good for our body? Absolutely. Yes, I'm a family practice physician. Scrums, I would want to consider a consultation and go over all of your labs. Simply recommending a certain number of eggs is not going to be beneficial for you. Okay. Sup Pongo, did I answer your question on the super chat? I appreciate that. Thank you so much. Do I think people who laugh often live longer? Studies have shown that, haven't they, Thomas? I truly believe. Yep, I answered that question 1910. It's 1 gram per pound of ideal body weight for muscle growth. Lifting weights and doing all that. Got to be lifting weights. Can't just eat protein and expect your muscles to grow. I'm going to skip to the end. I don't know if there's other questions in here. Terry says, do you recommend a carnivore diet? Absolutely. It's the most nutritionally dense diet that you can probably consume. James, if you want to improve your anxiety and depression, do the opposite diet that the person who has anxiety and depression are doing. If they're eating high carb diet, switch to a meat, salt, and water. Do it for 30 days and watch their anxiety, watch their mental health improve. Elimination diet, meat, salt, and water. Yeah, and stop drinking. But that if meat, salt, and water are only things on the diet, then that's going to eliminate the alcohol. Carson, just have your doctor do a zonulin level. Thank you. Okay. Ollie says, my heart is making extra beats. You guys, if I have a super chat, please let me know so I can skip down to it. My heart is making extra beats. Doctors say it's not a problem. Myself feel low acetylcholine due to, so it sounds like you might be having some premature atrial contractions, PACs or PVCs, premature ventricular contractions. I would probably ask the cardiologist to look into this and why you're having them. Oh, Anthony has an enlarged heart. So I'm guessing, is it ventricular hypertrophy or atrial hypertrophy? I'm going to skip to the end. I'm going to go and make sure there's no super chats so I can skip to those. So if you have a question, you have to restate it. Joe says, my wife is in her second trimester of pregnancy. She has been having pain in her arms and hands at night. This is inflammatory. It's very common with pregnancy. Doctor says it's normal. Well, I wouldn't say it's normal. I mean, it's not normal to have aches and pains in your arms. It could be coming out of her neck if her neck is positioned in a certain direction. But yeah, even during pregnancy, even carpal tunnel is more prevalent during pregnancy. I don't think it's normal, but is it more prevalent? Yes. So she's definitely inflamed somewhere, but I would reintroduce that question to them. Ethan, I would change your diet and I would do an elimination diet of meat, salt, and water and see how that does for you for 30 days. I agree, RM. It's unfortunate. Yes, I do have an IG account. It is IronLadyDoc. IronLadyDoc. Cheese, eggs, string beans with salmon in olive oil. Terry, maybe I would think, oh, by the way, thank you for the super chat. That was very kind. Or the super sticker. It's a super sticker, it looks like. So thank you for the super sticker. I appreciate it. Cheese, dairy, some people skip cheese. It's very fattening. Can be very fattening. Any dairy can be, especially liquid dairy, can be. String beans, again, that is a plant. That's up to you. I choose not to eat or consume any plants that grow in the ground, that grow in the soil, that have glyphosate and other heavy metals. I just choose not to do it. Salmon, I keep that to a minimum because of the ocean water is full of heavy metals as well. And if you're eating farm-raised salmon, that's even worse. Olive oil, it's not really olive oil. It's probably cut with a whole bunch of other seed oils that I would avoid. Use butter, tallow, lard, ghee as your oils to cook in. If you have urgency, thank you, Lucy. If you have an urgency to get your questions answered, please do a super chat. I appreciate that. We do have a super chat. Where is it? I don't see it. That must have been the super sticker that I just acknowledged. So thank you, Terry. I appreciate that. You're very kind. You guys are very generous. I appreciate that. Do I take protein before or after workouts? I don't. Are you referring to protein shakes? I don't. I stopped protein shakes probably 5 years ago. Protein shakes are processed. They're full of denatured amino acids. Denatured amino acids go into our system very, very rapidly, and they spike blood sugar. Spiking blood sugar spikes insulin. Any time we have spiking blood sugars. We have increased glycation. I try to avoid glycation at all aspects. I don't want spiked blood sugars at all. And I'm especially not going to take a protein powder when I can eat a steak. I eat my meat and eggs and butter after I work out, and usually I wait a couple hours even. I do not eat right away after my workouts. If you have more questions in regards to when you should consume your protein or how there's, Richard Smith is an awesome listen. Him and Stephen Thomas, they're very good. They're in Britain, I think. Okay. Extreme recluse, I would have to look into the actual vitamin C studies by Linus Pauling to answer whether or not I think it's valid or not. You have to ask yourself, this is the question, was it really vitamin C that was the problem? Just asking. Is there a best diet? Paleo, carnivore? I think the diet needs to be good for you. I would check your labs, I would see where they're at and adjust your diet accordingly. That's how I would look at it. A diet that's good for me might not be good for Cyber Shanghai. It just may not. I prefer a very low carb diet, and it is what I have always used to stay what I consider healthy. I feel the best. Despite the fact that when I was bodybuilding, the first month I was not in a good way, meaning I didn't feel well, but the next 3 months, I felt the best I've ever felt in my life. I know I would have felt even better had my coach suggested I do more fat. The fat I did choose to consume were MCTs. I was in the best shape of my life, and I had a spurt there of probably 10 years where I ate, I don't want to say healthy. I ate some carbs, I ate meat, I ate vegetables. I ate a lot of vegetables with my meat, and I gave that all up about 3 years ago. And now I basically eat meat, eggs, butter. I eat some bacon, but yeah, beef, salt, water, eggs. I mean, that's what I do. Yeah, Lucy, I agree. Wild caught salmon or fish is the best. Terry, I think I answered your question, hopefully. Is ghee better than seed oils? Yes. What if someone can't eat meat? Eat eggs, eat fish, eat pork. Meat to me is red meat. Eat chicken. If you're eating chicken, you have to know where the source is. Is it grain-fed? Because then if it is grain-fed, I would take away their fat. If they were pasture-raised chickens, I would eat their fat. It's a good source of omega-3s. So grain-fed chickens are very high in omega-6, high in lectins, very, very high in inflammatory, to increase inflammation in your body. So if I'm going to eat chicken and I know they're grain-fed, I remove the fat from them. Are there any questions on Instagram? No. Okay. Happy says I have a quarter-size cyst over the nerves in my face. What can I expect when they remove it? I don't know, but that is large. Which nerve is affected? Is it your facial nerve? I'm curious. Rick, I go back and forth on the turmeric powder, but I would never put a root plant in my body. It actually grows under the soil. It doesn't grow above, so it's a root plant. I avoid all root plants. And I go back and forth on whether or not black pepper destroys the inflammatory improvement of turmeric. But yeah, powder, it's been processed. I avoid it. But you guys can do what you want to do. Thank you, Terry. I appreciate your confirmation. I got your question answered. What do I think of avocado? Avocado is a plant. Coconut, it's a plant. I like coconut oil on my skin. I don't use coconut oil. I don't use avocado oil. I don't eat avocados. But if that's how you want to get your fat, then eat an avocado and get coconut oil. You know what? I'm going to take that back. I do add MCT oil to my water on occasion to help increase ketones. Fasting does the exact same thing. FZX, I hear from YouTube. I messaged you on IG. Do you have you messaged me. Okay, I'll watch for that when I get done. Lisa says, I get brown hard spots on my back. Those are likely liver spots or keratosis. They're an age spot. They're a liver spot. They're likely due to your diet. Oh, there's another super chat. Okay, I'll get to that. People who have insulin resistance are high risk for getting those brown hard spots on their. Terry says, can a carnivore diet improve your body within a month? Thank you for the super chat. I appreciate it. Can it heal your body? Can it improve your body? Absolutely can improve your body, but I don't know what the improvements you're looking for. Are you looking for fat reduction? The answer is yes. Carnivore diet will help. Will it decrease the inflammation? The answer is yes. Will it help you think better? The answer is yes. Will it help your heart heal? The answer is yes. So what part of your body are you trying to improve? But a carnivore diet that is ketogenic, it has no carbs, will heal your body. You will feel healing in a month. Absolutely. Thank you, Lucy. I appreciate your watching this. I'm glad you guys are here. Does chicken have iron? It's very limited. Remember, white meats are not going to have much iron. You need heme iron, so you could eat brown, the dark meat. That's going to have heme iron. Heme iron is very important for us. It's easily absorbable. It's 30% absorbable, whereas non-heme iron, which comes from plants or processed foods, that's what they fortify our foods with, is non-heme iron. Non-heme iron cannot be absorbed. It accumulates in our organs, in our tissues, in our cells. Non-heme iron increases our risk of oxidation, and we get increasing amounts of rusting. You're basically rusting in your body with non-heme iron. It gets stuck. A lot of people get iron trapping, especially if they're doing high doses of vitamin D, which lowers vitamin A, which lowers copper, and low copper causes driving of iron into the liver cells. It's all over bad. And so you people who are on high doses of vitamin D because you've been told your vitamin D was lower, you want to not have a cold. Yeah, you're causing destruction inside your body. Haley's, okay, yeah, Haley, yeah, if you got an urgent question, I can't find it, but if you super chat me, that will get it sent to the top. How many times a day do you exercise? One time. I do it in the morning. Oaf says, first time I see your video, very impressed, thank you. Please share it. If something I say helps you, maybe it could help somebody else. So please share it to the other social media platforms if you can. Share it to friends and family. Subscribe. Do the clicks, the clickety-clack. I call it clickety-clacking. Helps the algorithms. So hit the thumbs up, hit the hearts, hit those things. It helps me. Okay. Best herb for weight loss. I wouldn't, instead of adding whatever, I would subtract what is ever causing your weight gain. NYG, I did not know that about black pepper. I will look it up. How do you do a super chat? There is a little heart with a dollar sign in where you wrote your heart. Where you wrote your comment to the far, I believe it's on the far right, there's a little heart with a little dollar sign in it, and then you can decide if it's a super sticker, super chat, super whatever. Thank you, FZ, I appreciate it. Ollie says they noticed black pepper causing histamine issues. I've seen that. I've seen more histamine issues with fermented foods, especially aged meats. Oh yeah, peppers. Yeah, it's very high in oxalates. You guys read Toxic Superfood by Sally Norton if you want some history on oxalates. It's well worth the read. I've read a lot of books, and she's somebody I follow and respect. Zoe says fasting is the best thing to do. It just depends. Thanks, Ken. I appreciate it. This lady is zero fluff, simply rapid fire, relevant information. Thanks. I dig it. You're very welcome. Please share, could you? I fast to keep my diverticulitis under control. Do you agree? Fasting, ketones will actually decrease inflammation. So if you're fasting and you're getting into ketosis or ketones, as I've mentioned in the past, decrease inflammation. So your diverticulitis means of the diverticula. You have diverticula, you have little caves, you have outpouchings or inpouchings of your colon that things can get stuck in there, like seeds and nuts and crap. That can get stuck in there. It can get infected, and then you get a case of itis, inflammation. You likely will need some antibiotics. It can be very painful, usually in the left lower quadrant of your belly. Do I agree with fasting for that case? I would also, yeah, you can fast. Ketones are healing, but you need to get rid of what's causing your diverticulitis. Blood pressure will improve by going on if you're on blood pressure medicines, please talk to your doctor. You will need to adjust those when you're going on a carnivore diet. Carnivore diet lowers blood sugar. Blood sugar lowers insulin. Decreased insulin causes release of water and salt in your urine. You will lose a lot of water, and that helped to, in the past, keep your blood pressure elevated. That is pathologic water. That water you lose when you start a carnivore diet. When you lower your blood sugars, you lower your insulin, that water that you are peeing out rapidly, along with the salt, is pathologic water. You didn't need it. It was causing problems, and it was also increasing your blood pressure. So if you're on medicines, have those adjusted. Watch that you'll need some very good salt, not processed salt, but you're not going to be eating processed salt on a fast or a carnivore diet, but you need a good salt. The salt of my choice is Jacobsen's. I like Jacobsen's salt the best. Ali, glycine, I'd have to look into that as it relates to chicken. I've not heard that, but thank you. Those are jail. Those are nightshades. You're eating a lot of nightshades. They're going to cause problems. Nightshades are very inflammatory, so I can see why you're having tummy problems. Drink water, stay hydrated. Okay, don't drink too much. We overhydrate. Your urine should not, you heard me, I said not be clear and white. Then your kidneys are working overtime to try to concentrate whatever is in your body. It's not good for your kidneys. It's leading to chronic kidney disease, among other things. The most common cause of chronic kidney disease is diabetes, high blood sugar, high insulin resistance, pre-diabetes. That is the most common cause of kidney disease, as well as coronary artery disease. It's also the most common cause of diabetes. So high blood sugars equal diabetes. You just don't know it yet. Get an insulin level and you'll know 10 years in advance. Okay. All right. Tori, just eat just fruits and vegetables for a whole week and you'll see what happens. With what, Tori? Your glycation? You want to simply lose weight? Okay, thank you, Linda. I appreciate you being here. How to reverse diverticulitis. You could take antibiotics. You might need to at that point. But again, reversing diverticulitis, I don't know if you can heal diverticula. I would have to look into that. Talk to your GI doctor. They're going to tell you high fiber, but again, that is a carbohydrate. We do not break down fiber by definition. It is indigestible. It is causing waste products. It's roughage, and it's roughing up your colon. If you're eating carbohydrates, yeah, I think you should probably eat some fiber. If you're not eating carbohydrates, I don't think you need it. Again, this is for information purposes only. This is not medical advice. Talk to your PCP. My consultations are to provide you with information to take back to your doctors and have a civil conversation with them. Olin, you're very welcome. I appreciate it. Yeah, Zoe, on sea salt, I watch where it comes from. I try to stay away from anything from, the Himalayas because it is high in aluminum and iron. They're putting that in it to make the color. So I've been sticking with Jacobson's for the most part right now. I was using Baja Gold, but I like Jacobson's better. Don't ever quit. What's your thoughts on celery cleanse? I don't know that I have thoughts on a celery cleanse. I would ask myself, why are you doing a celery cleanse? Oh, your mom's husband did it and worms came out. Pathogens, all pathogens, whether it be parasites. Would you like to say hi to the group? No, that was Talo. Talo's telling me that, go lay down. Go lay down. Thank you. Go lay down. What do parasites consume? Sugar and iron. Those iron, all pathogens, fungus, virus, bacteria, parasites, they love to eat iron. And guess what? People who eat processed food diet are high in non-heme iron that is stuck in our body and feeding pathogens. These people are always the sickest. And yeah, she could have done any kind of cleanse and worms might have come out. I mean, who knows? Were they still moving? I'm curious. Terry says, is it good to raise your heart rate a little bit? Of course it is. Yep, of course. And you want to note that it comes down very rapidly. You don't want it to raise and then stay high. That's why I like HIIT. So Terry, if you're interested in still continuing to do cardio, I would do HIIT, high intensity interval training. It'll raise your heart rate, and then the heart rate comes down quite rapidly within a minute. Finn, I would talk to your physician about that. You got up in the morning, got dizzy after sitting on their couch. So yeah, I would see your doctor. I would check your blood pressure. Have them check your blood pressure lying, seating, and then stand up. Okay? Those are orthostatic blood pressures. You want to get orthostatic blood pressures. FC, I'm having a great day. Thank you for asking. What about multivitamins? Why do you need them? If you're on a processed food standard American diet, then take a multivitamin, but you're only increasing non-heme iron, which is, again, feeding all of the oxidation. You're rusting inside. You want to add more non-heme iron to rust more, cause more oxidation? I don't. How do you reduce cortisol levels? Well, we need cortisol, Zucky. That is for sure. You cannot live without cortisol. How do you know it's too high? Have you done a cortisol level? Thank you, FC. I appreciate that. Yep, Zoe, I agree. Drink when you're thirsty. Yes, Ghetto, I agree. Better sleep, Zucky, for sure. Pray, meditate, do whatever. I pray. I do breathing exercises. I do vagal tone exercises to increase. Yes, I do. It is attached to the store. I do have a store. There are, I added, thank you to NJ for reminding me to add my apparel and other accessories to the store. It is on YouTube and you will see it. It'll be a link and it'll go right to the store and you can add away. Yeah, that is the only place NJ, that is the only place I have my apparel is on YouTube store. It is fourth wall. And you'll see it. It's a link to the store. In fact, I put 6 items to tag in this particular live stream today. So you can look those over. Observant Ann, you should hear a story by Dr. Anthony Chaffee, Chaffee, when he was talking about a mother who had an autistic boy and she put him on, he was nonverbal. She put him on a carnivore diet, basically meat, salt, and water, and he started talking. Carbohydrates are destroying our brain and our nerves. Cliff says the body needs 150 grams of glucose. If the body needs 150 grams of glucose, it does not. The normal amount of blood sugar that we should have in our body at any one time in the average adult who's got about 5 liters of blood is 5 grams. 5 grams, that's all you need. So we're overindulging in our carbohydrates. Bella likes Baja Gold. I like it. I just like Jacobson's better. Hey, hello, doctor. I'm a first-time watcher to your live stream, I'm guessing. So thank you for being here. I appreciate it. Hopefully you'll come back. What is a maximum dose of taking vitamin D for adults? I don't recommend taking any vitamin D until you have your levels checked. So go to your doctor, get an active form of vitamin D level as well as a stored form of vitamin D. You can look them up. Just Google what is the name of the active vitamin D and the stored vitamin D. Get your ratio. They should be 2 to 1 active to stored. About a 45 of active and about a 25 of stored, and you should know whether or not you need vitamin D. Magnesium K2, if you're on a statin, you're definitely not making any vitamin K. Probably your vitamin D is low as well. Instead of taking supplements, why don't you consider getting outside? How does increase iron for anemic people or hemoglobin E? How increase iron? How increase iron for anemic? I think this is something that probably needs a consultation, observant, and definitely I would see a hematologist. Allergic to cucumbers, avocado, blueberries, strawberries, lip swelling. What do you think? Don't eat them. That's not medical advice. That just seems logical to me. Low Pro, it's asking about water. Drinking half your weight in ounces. I'm guessing your body weight in pounds. You're drinking half of your weight in ounces. For adequate hydration, what is my recommendation? Thank you. I think you should drink when you're thirsty and don't drink when you're not thirsty. If your urine is getting clear to white, you're overhydrating. Yeah, Zoe, I like Jacobson's salt. I do not use Redmond's real salt anymore. I believe it's from Utah, but Jacobson's is also from Utah, if I recall. Or maybe it's from Tennessee. Maybe Jacobson's is in Tennessee. I can't remember. Terry, so you're under the impression that God made us a special diet for everybody with different blood types? I don't know about that. I don't think I can get on board with that. Tori says, I'm allergic. I don't know what allergic means. Do you get a rash? Do you get anaphylactic shock? Or you just don't tolerate them because of your gut? Either way, if you do not tolerate celery, peas, carrots, and certain types of beans, does it mean something? Yeah, it means you do not tolerate them and you shouldn't eat them. Okay, don't ever quit, they were dead. So did you take them in to have pathology look at them and see what they were, if they were really worms? Oh, I thought my cast iron was good for cooking. It leaches iron and non-heme iron at that into our body. So I probably would not be using a cast iron pan, maybe stainless steel. How do I keep my hair from graying? Or are you asking me, from graying? How do I keep my hair from graying? I eat a carnivore diet. I sleep well. I exercise daily. I get out in the sun. I think positive thoughts. I pray to God. those are the things. And I will probably go gray at some point, but I think graying is a sign of iron overload. I think graying is a sign of glycation. It's aging, causing advanced glycation end products, a sugar plus a protein. The sugar gums up your protein, and we have protein in our hair. We have melanin in our hair. We do not produce those proteins, or they're being destroyed by the sugar. Smoking, stress, all kinds of stuff increase inflammation in our body, oxidation, advanced glycation end products. Those are all leading to graying. Melissa says, I feel the Lord is telling me to fast. This is the 4th or 5th time that I have come across fasting in some way. I just don't know where to start. Well, fasting is something that can be very, how do I say it? From a biblical perspective, there was fasting going on. But again, I don't know your medical history or the medications you're on or whatnot, but you know, I would pray about it. I would see your doctor. If you are on medications, you should not be fasting if there's other conditions. And I don't know what those other conditions are, so I can't comment. Observant Ann says, Steak and Butter Gal said to use butter to lower cortisol. I'm guessing from the BHB, the beta hydroxybutyrate that's from butter. It is a ketone. To, you know, either, I mean, you can take ketones. I prefer to get mine through food or fasting. Mrs. 42233, that's interesting. Thanks for sharing. I would change your diet. Jai, if the diatomaceous earth, the one you make, destroys the tapeworms by shredding them, what do you think diatomaceous earth and the crystals are doing? They do it to ants too, by the way. What do you think it's actually doing to the insides of your gut? Just keep that in mind. If it's doing it to the tapeworm, what's it doing to the lining of your gut? Is it shredding that too? Is it increasing inflammation? Is the inflammation causing gap junctions and then leaky gut syndrome? Yes, Chafee, that's how you spell it. Chaffee. He's very interesting to listen to. He's in Australia. Are cleavers good for iron? It depends. I mean, you can, you know, you want to sequester iron. You want to, you want to bind iron. You want to chelate iron. I don't know what a cleaver is. Statins made my dad forget me in one day. I'm sorry to hear that. Bob just got placed on a statin, a blood pressure medicine, and a GLP. All three. Excellent. Why? My MCT oil source is, I get it on Amazon. It's organic. It's got obviously a brown bottle. It's got a white label. Nature's something natural. I can't remember. It's one of the first that pop up, and I've been on that one for a long time, and it's the one, if to get an MCT oil, it's the one I promote. Oops. Oh yeah, good call on that, Ali. I do like Robbins a lot. That book is amazing, and if you need to read that book. It's just It just came out. I can't remember. If you can help me with the name of it. Yeah, Mr. Robbins. He's pretty smart. Let's see. Ron, I can't comment on your addiction. You need to talk to your PCP. I have my theories, though. That's for sure. NJ, I have no thoughts on Irish moss. What do I do for my electrolytes? I eat salt. Salt has minerals in it. Celtic salt, I stayed away from it now. Heard there was aluminum and increased amounts of iron in it, so I stay away. Observant Anna, I used to think that too about clear urine. The husband with the bubbles, I mean, yes, most men who pee standing up will have more bubbles, but if it's more than usual, I would check oxalates. He's likely got oxalate toxicity. Does a low hemoglobin have an effect on cardioversion? It's possible. That could be one of the reasons that you had an arrhythmia. I don't know. Be a great question for you and the cardiologist. Do we have any super chats? Doesn't look like it. Yeah, thank you. On Facebook, actually, Lucy, it's Center Stage Primary Care. Center Stage Primary Care is Facebook. It's the only one that's different. Everywhere else, it's at IronLadyDoc. I'm going to go to the end, see if we got some questions here. Yes, cure your fatigue. Thank you, thank you. That is it. Yep, and it's CU for copper. That's what the big C, big U is for, is copper. He believes that copper is likely the problem of everything. It relates back to vitamin A, vitamin D, magnesium. I mean, he goes into it. It's a deep, deep book, but it was very interesting. He thinks that low copper is one of the reasons that we have iron overload. And the reason we have iron overload, or one of the results of having iron overload, because of low copper, low vitamin A, high vitamin D. You know, the triad that they told us to do, especially when we got sick, or maybe 5 years ago or so, they would tell us to take high dose vitamin D, high dose zinc, and so zinc, D, and C, zinc, C, and D. They told us to do that as a terrible triad for production of problems with iron overload. It'll lower copper, and we have a problem. We have a big problem. So people were told maybe to harm themselves. They were trying to stay natural, and it didn't work. Okay. Sin City says, me and my daughter never took the shots and we never got sick. Dr. Ford Brewer is a great cardiologist to watch on YouTube for heart questions. Thank you. I'll look into it. Okay. What causes low iron saturation? Non-heme iron is it's not absorbable. And for the most part, if you get an iron saturation that is low, I think iron overload automatically. I look at some other things to see about hemochromatosis or even ferroptosis. It's kind of stages. Ferroptosis, by the time you get there, you're getting death of cells. And it's extremely dangerous. I think it's causing a lot of the chronic diseases that we have right now, but it all goes together. I'm not a reductionist. You know, some people say, oh, it's all iron overload. Some people say it's all insulin. Some people say it's all seed oils. It's all of that, I think, you guys. And in reality, we can't live in a bubble. You know, you can't prevent every single thing. And, you know, the simple things is, here's simple, is eat a low carb diet. Sleep 8 or 9 hours a day. Get out in the sun daily. Pray or meditate or do what you do. Stand barefoot on the ground. Associate yourself with people who love you. I mean, really love you. Not fake love, like love. Okay? These are the important things. Your diet is extremely, extremely important. It's like the hub. And so if you want to bypass your diet because you love your abundance of prosperity and you just like it, then do it. But why would you try to make up for it by adding a whole bunch of other crap? It just tells me that you should just stop whatever you're eating that's causing it. But again, that is up to you. So hopefully that helps. Again, we can't live in a bubble. We can only do as good as we can do. But for those of you who do not want to change your diet and you're going to add all these things, I mean, why? Why waste your money? Which magnesium salt do I prefer? If you're going to do it, I would do a combination. Maybe malate, orotate, threonate, bisglycinate, maybe a combination. Depends on where you want it to be working. Citrate and oxide are for constipation. So I guess it depends on what you're wanting to have, you know, to work, magnesium to work on. Okay? Yes, I do believe plants are for our health. They are for medicines, but medicines aren't taken every single day, are they? They're taken for a short period of time, like 7 to 10 days. They're not taken on a regular basis. That is only causing problems. There's more anti-nutrients in a plant than there are nutrients, especially the fake ones we have today. Bella says, I noticed many O blood types never got COVID. Okay. I know some ABs that never got COVID. I know some B negatives that never got COVID. I don't know if that has any relation. Was that just something that they were telling us? I don't know. I'm not disregarding it. I don't know. What is a healthy butter? The butter I use, gosh, Lucy, I cannot read. If Lucy is listening, I cannot read messages right now while I'm online, while I'm in a live stream. Okay. Okay. The butter is Organic Valley. I use Organic Valley. No, getting iodized salt is not in your best interest. By the time it hits the air, it's basically evaporated. So iodized salt, I don't believe is going to do anything. Okay. Skipping to the end. Ralph, thank you for the super sticker. I appreciate it. For those of you who are wondering what that buzzing is, that is Lucy messaging me. Let's see. I do appreciate the super sticker. That's very kind of you. That helps. It all adds up, you guys. Neil says grounding is very important. I agree. Walking barefoot on the grass. I agree. Soil, not concrete. I agree. Hugging trees. I agree. Actually, you'd be surprised on how much the electrons are discharged by just even leaning up against a tree. It is amazing. So Neo, I agree. I'll check into that in regards to Dr. Peter Osborne. I'm not familiar. Is RFK getting rid of junk food? It doesn't matter. Are you, Ralph, getting rid of junk food? How about that? This is an individual thing. You need to wonder if you are going to get rid of junk food. Who cares about anybody else? Do you wonder if I'm going to get rid of junk food? Do you wonder if your brother or sister or coworker is going to you shouldn't, it doesn't matter. It doesn't matter if they get rid of junk food. You are the one that is responsible for you deciding, are you going to get rid of junk food? Christopher says, yep, that's why they invented shoes for us to wear, because we don't get grounded. Exactly. And that's why the soles on our shoes are getting thicker and thicker and thicker, like Hoka's and all those brands. They're starting to get thicker. I mean, they even got Uggs that have platform. It's just getting you further and further away from the earth, isn't it? Just my thoughts on it. RM, thank you for your knowledge. I'm leaving since I have, the flu. I'm sorry to hear that. Get better, okay? Ali is A negative and didn't get COVID. Awesome. Evan Brand is the best on mold information. You guys are gonna have to send these to me in messages. I won't remember them all. Jeff, I don't know if legislatures will get rid of junk food, but does it really matter? I mean, you have to be the maker, whether the junk food is there or not there. You have to be the maker of your own ideas, whether or not, if you want to get rid of junk food, it doesn't matter what anybody else does, legislature or whatever. I do not use Himalayan salt. I use Jacobson's. Yes, I probably think, Nick, that Thick shoes are unhealthy, only because they're great if you don't want to step on glass and hard rocks, right? But as far as just take them off and stand on the ground, barefoot. Just take them off. So thick shoes are awesome when you need them. And then take them off if you want to ground. Bella, thank you. I appreciate it. Oh, Terry, that is a great observation. Terry says, I've noticed that these screens make us more nearsighted. You know, there is, I don't want to say gurus, there's influencers, there's providers, there's people online who tell us that actually even wearing glasses, so wearing readers, worsen our eyes. We'll just get stronger and stronger and stronger because we have made our eyes so weak, we don't even use the muscles anymore. The caveat to that, Terry, is a person who started out farsighted. If a person starts out farsighted, so they were born mostly farsighted, they have extremely good eyesight when they're younger. But because they're farsighted, they've actually changed the shape of their eyeballs, lengthened them, okay? And so the muscles were working so hard to focus for years. Now that person, it cannot see up close, okay? So they do changing your diet or taking your glasses off. There's these glasses, I don't know, pinhole glasses. These are called pinhole glasses. If you guys have ever if you wear readers and then you put pinhole glasses on, you'll be amazed at what you can see without your readers. And it's because of the refraction that's going on, okay? So, look into it, but I think there's caveats to that, Nick, and or was it Terry? Terry, yeah, I think it was Terry that asked that question. There's just caveats, and yes, it's possible that wearing glasses, being on these screens, it's causing a lot. I mean, it's even the light. It's the light. Neo, I agree. Fabrics. I mean, all these women wearing the Lululemon and all of that, you got to wonder what is going on, the polyesters. So cotton and linen, I agree, might be our best choices if we can find it. So there's Jane. She's B positive. Husband is AB positive, never got sick. So is it blood type? I don't know. Yeah, healthy diet and exercise. I agree. They are winners when it comes to our health. Be careful what we want banned by legislation, okay? You're looking at, just be careful what you wish for on things that are being banned. Anton says, thank you, doctor, for the beautiful lessons. You're very welcome. Please share and subscribe. Please hit the thumbs up and do all of that. I really appreciate it. Sea salt or Himalayan salt? I choose sea salt. Christopher, I can't answer that question. I have no idea. Yeah, polyester, again, I try to stay away from polyester, but sometimes it's difficult, especially when I want to order some of my own apparel from the YouTube store. Yeah, okay. Yeah, Drake, thanks for sharing. You guys are awesome. I'm going to call it quits today. We do this every Saturday and Sunday. So Saturday at 9 a.m. Central. So Saturday, 9 a.m. Central. Sunday, 10 a.m. Central. Lord willing, I will be back next weekend. I do reels through the week, 3-4 days a week. I will do a reel on a topic of choice. Sometimes you guys message me and say, hey, will you do a reel on this? But a lot of times it's from something that I am reading. I read all the time. I love to read. I love to learn. That's why I like to share things with you. Whether my information is 100% accurate or not, I'm hoping that I get your brain to open up and start going and looking up things for for yourself. Ralph, thank you for the super chat. I appreciate that. That's very kind. I just appreciate you guys supporting me. The dollars add up. I am not working in an office anymore. I decided to leave my practice. I closed my practice in April, and I only do online consultations. I didn't feel that I could treat or help as many people, seeing only 10, 11, 12 patients in a day, where I can talk to 3,000 people online. That is more important to me, is getting you guys to open up so you get enough information. You can take it back to your doctor. I'm like a doctor in your back pocket. I'm not your doctor, and you guys are not my patients. In fact, I don't even really have patients anymore. They are online clients that really want to get more information. So if they go to their doctor, they can say, hey, doc, I learned this. You don't have to say where you learned it, because you don't want to turn your doctor off and say, I learned it on social media, because that's just going to turn them off. They have an ego. Trust me, they have an ego. And so you don't want to get them angry. You just say, hey, I thought I learned, I learned something, something here, and I, is this true, or what are your thoughts on it? Open dialogue. You need information so you can actually ask the right questions. Do you think in 5 minutes that your doctor is going to supply all of the information and the questions that you asked? I did that in 2 hours. 2 hours. They are not going to take the time. They don't have the time. This is worth their time. If this is what makes their world go round. Of course, they wanted to go into medicine to help. I don't think that doctors are nefarious. Well, a majority. But, abundance and prosperity, doctors are sinners. They put their pants on the exact same way as you do, okay? And they are sinners. So we need to take that all into consideration. But you need to educate yourself. You need to be your own advocate, okay? You need to be your own advocate. You need to increase your knowledge. You need to listen to not only me, but you need to listen to a bunch of people. And you need to get out of your cognitive dissonance. Get out of your matrix. Start learning something. Even if it's wrong, open up your brain to other things. That is my hope for you guys. It's my hope that I can stimulate your brain to start opening up and stop living in a world where they have programmed you, whoever that is. I say they, I have no idea who they are, but you are being programmed, or else you wouldn't have these questions. Think about it. If you weren't programmed in such a way, you wouldn't have these questions that you're doubtful. You are actually doubting yourself. You're doubting yourself. Your reality isn't there. And so you're doubting yourself, and you're going to online doctors, and you're going to online chiropractors, and you're just listening in hopes that a whole bunch of people are not radicalizing your brain, okay? But think about how there are ways that they can get you going down one path and never experiencing like a tree and going out on branches. Think about it as you go through the week, and start picking up on how you're being influenced. Is it social media? Is it the TV? How are they influencing your brain? Start to think about, oh, they're using that tactic. That's a sabotage tactic. That's deflection. That's whatever tactic they're using it. And then they got, if you're worried about the food, becoming addicted to it, you're becoming addicted to it because there are people called global flavorists out there, global flavorists. They're hired to make things palatable, succulent, seductive to your mouth, so you'll continue to eat it. It's nothing you probably would have chose, but that one time you go, I think I want a Dorito. Now you can't stop. I want an Oreo. Yeah, now you can't stop. I can't stop. People are not addicted to steak. They're not going to say, God, I'm so addicted. I can't wait to get my next steak. Well, if you're a carnivore, you're so hungry you want a steak, okay? But honestly, you don't get addicted to steak. You'll stop eating it. Once you're full, you'll stop eating steak. Once you're full, you'll stop eating eggs. The fact that you are full of eggs and steak and then you choose something else, you're not hungry. You are not hungry. That is pathological. You are eating something when you're not hungry, because if you were hungry, you would eat more steak and eggs. Just my thoughts on it. You're not addicted to steak and eggs. You're addicted to crapola. All right, you guys? Hopefully you'll have a wonderful rest of a blessed Sunday, I should say. Have a blessed Sunday. I will be back. Please share, like, do the things that would help this channel get more. Go to the store. Please go to the store. See if there's something that you don't want to. We got the buffoonery busters out, and don't be no longer bamboozled by the buffoonery gear. You're welcome, Krista. What about coffee addiction? I think we're still in that. So I'll let you know when I figure it out. All right. Anthony, thank you. Appreciate it. So you guys have a blessed Sunday. See ya.